When you herniate these annular fibers, the nucleus moves out of position. Now we understand that two things cannot occupy the same spot at the same time, right? It's not possible for you and you and you to be standing exactly on the same spot. Somebody's got to move. This is what happens when you herniate these fibers. The nucleus winds up pushing off to the side. As a result, whatever was here gets pushed out and creates this. What do you think that is called?
A bulging disc.
That's exactly what that is called. And ultimately, why is a bulging disc such a bad thing? So, it's a bulging disc. It's inside. Nobody can see it. Your spine's already corrected itself a few times. Who cares, right? Anybody know anybody with a herniated or a bulging disc who is absolutely comfortable all the time? It is a problem, isn't it, right?
Yes.
Why do you think that's a problem? What do you think exits right out here?
The fluid?
That is a nerve. Okay, let's take a look at it. What are these yellow things right here?
Nerves.
Nerves. Okay. Now look how conveniently the disc and the nerve are all at the same segment and level. You see that?
Oh, wow.
They're pretty close to each other, aren't they? So, and conveniently, whoever made this little plastic model was very helpful to me because they also put a bulging disc over there. Can you guys see that little red thing?
Oh, yeah.
Okay. When this thing bulges out, now two things also cannot occupy the same space at the same time. The nerve and the bulging disc now are competing for space. Who do you think is going to win that battle?
The bulging disc.
That's right. Actually, it's been said that the spinal cord itself has roughly the consistency of cream cheese. Is that tough stuff, really tough material? Would you build a house on cream cheese?
No.
It's not exactly built to hold you up. It's not exactly built for anything coming in there and messing it up. When this bulge goes out and starts to compete for space with the nerve loses. Anybody heard the term sciatica?
Yes. Yes.
What is sciatica? Sciatica is essentially the name of it's the biggest nerve in our body. Usually nerves are tiny little strings going all over the place, but in this case it's like a rope. It actually goes down the back of your leg right here. Now anybody who's ever had sciatica will describe several things. One is it feels like a sharp pain going down the back of my leg.
Correct.
And if it's bad enough, it's going to be accompanied with numbness, tingling. Sometimes if it's bad enough, it'll actually start to translate into atrophy, motor neuron problems, foot drop. In other words, when they walk, they can't lift their foot up. There's a lot. We're not going to go through the whole list of bad things that happen to people when this happens. But when you put pressure on nerves, bad things happen. One of them is pain. I always like to ask this question. If you were to put a definition to the central nervous system, what would you define it as? What is the definition of, I want everybody to think about this. What is the definition of central nervous system? Well, what I did is I went to Grey's Anatomy. Anybody heard of that?
No.
It's not just a TV show. It's actually a book. And if you go back and read the definition of central nervous system, this is what it says. It is the system which controls and coordinates every other system of the body. Would you say that's a kind of important definition?
Oh, yeah.
Okay. Now, when you put pressure on the nervous system, you get more than just pain. Okay. We all know about sciatica. We all know about that pinched nerve that goes down the arm. We all know about the sharp pain that's associated with those kind of things. Very important to take those in mind, but more than that happens. Research has shown when you put pressure on a nerve, you create what is called hyperreflexia down the pathway of that nerve. Have you guys ever gone to the doctor and they tap on your knees?
Yes.
Okay, what happens when they tap on the knee?
Yeah.
That's right. Now, if I were to tap on that knee, then I tap on the other knee, and one of them just kicks up a little bit, the other one kicks right up like crazy. Is that a bad thing?
Yes.
Okay, that's what we call hyperreflexia. So we know how to measure it. Everybody knows it exists. That's why they're always testing you for it. What happens is when they tap on one and it goes up a little bit, the other one goes up a lot, they know there's pressure on the nervous system somewhere. Okay, since it's such a broad thing, they're not telling, oh, a specific nerve right there. It could be a brain tumor. They don't know. But ultimately, they want to make sure these things are even, because what they're measuring is exactly what I mentioned. Now, let's talk about how the nervous system affects the lungs. It's very important to understand that the body is a very dynamic mechanism. The fact that I'm standing here talking means I'm expending more energy than you guys sitting there listening, versus somebody who is running a marathon down the street. He's expending a lot of energy. Whose oxygen needs do you think physiologically are going to be higher, the marathon guy or you guys?
Nerve.
Okay. How does the body adapt and actually supply all of this? Well, one of the things that it does to the lungs are filled with these little sacs we call alveoli. Those alveoli are not constant little pockets. They expand, they contract, they're constantly in a state of dynamic compensation for what it is that our physiology actually needs. Who do you think controls that expand, contract, expand, contract?
The nerves?
That's right. Now, we already know that when you put pressure on a nerve that goes to whatever organ it goes to, it's going to have hyperreflexia effects. So that means those alveoli are not going to exactly respond properly, are they? If we were to actually look at it, I have a little chart here that shows it. I'm going to just read it for you because it's hard to see it. But T1, the first symptom that follows it is asthma. Okay, very important to understand. Now, there is a treatment for asthma in medicine. They're little inhalers, aren't they, right? Okay, some of you are nodding vehemently because you've experienced it. Now,
Yes.
what happens? What's in that thing? Some of it is adrenaline. Okay, some of it is there's stimulants in that stuff. Why do they put stimulants in those little inhalers? Because those alveoli are chemically shrunken back down to a more physiologically appropriate size. If I'm taking in more oxygen than I need, that's not good. If I'm taking in less, we know that's not good either. So in many cases, not all cases, I mean there's variations to a lot of the stuff I'm talking about, but in many cases, the reason people get those type of symptoms is because the central nervous system is not able to properly adjust to its environment. And the primary way we can interfere with the central nervous system's ability to adapt to its environment, messing around with those nerves.
So, if I have a pinched nerve, that can affect my acid reflux?
Yes.
Wow.
Make a long story short.
Asthma also.
See, this is just a microcosm of a nerve chart that I like to give my patients. And what it is, everybody thinks it's something that was made up of a bunch of chiropractors. That's not the case. It actually comes straight out of Gray's Anatomy. Okay, Gray's Anatomy is a textbook that all doctors study. And ultimately, this is a direct correlation that's been made when you interfere with the nervous system at different levels and specific symptoms you can actually follow. Now, I use T1 as an example, asthma. T6, we already talked about stomach troubles, indigestion. See, those are just two examples, but I wanted to cover that to show you guys there's more that goes on with the central nervous system that just cause pain.